Hi, Mark coming to you from Physical of Eversville. Today, let's talk about the 4 P's. Poor posture promotes problems. Here's what I see a lot in a clinical setting. More often than not, when I get a patient who's having pain, it's not because of a traumatic injury, it is because their body has broken down somewhere. By this, I mean they've been using poor posture or poor mechanics. They've been either sitting incorrectly, standing, walking incorrectly, lifting incorrectly, you name it, but whatever they're doing is not according to the mechanics that their body is meant to be used. So when this happens, it's not a matter of if your body's going to break down, it's just a matter of when. It's no different than buying a brand new car with the tires misaligned. When you drive that car off the lot, it's not a matter of if the tires are going to wear out. They are going to wear out. You just don't know how fast because it depends on how much use you put on them. Body works the same way. If you don't use correct mechanics, it's not a matter of if, it's just a matter of when. If you're doing a lot of things wrong, it could be a whole lot faster than if you're not doing as many things wrong. If you're very sedentary, it might take even a lot longer. But typically, unless you're just a genetic freak, you're going to break down at some particular point in time, and then you're going to have pain. And then the conversation goes like this. I got up today, I bent over, picked up a Kleenex, my back went out. I don't know what I did. I didn't do anything different yesterday or today, but my back went out. My back's never went out. It wasn't the Kleenex, it wasn't that you bent over that particular time, it was the fact that your body's been breaking down over time. And when that occurs, when the cup is full, from under a dripping faucet, when that cup is full, it's going to go. And any little motion then can set it off, and then it leaves you wondering why. Well, why is because it's been breaking down for a long time. So what happens when that occurs? You've got to change what made it bad to begin with. Just like the automobile, you take it back into the mechanic, you got 2 choices, change the tires or realign the car. If you change the tires, what did you do? You put a Band-Aid on the problem. So you'll get away with it for a while again, but you're going to have the same problem again at some point in time. So if you only settle for medications, injections, massages, rolling out, exercises that aren't done with correct mechanics, you can make yourself feel better for a little while, but you haven't corrected the problem. So the problem's going to return, and typical history is it returns with more pain and typically lasts longer. So what do you want to do when you take that car in? Same thing with your body. Correct the cause. The cause can typically be drawn to incorrect mechanics. We're a seated society. First thing people do, they tell me how long they sit at a computer. Here's their typical posture, like this. 4 or 5 hours sitting like this, everything on that back side is getting overstressed and going to break down. Instead of correcting how you sit, which is back supported, so in a good curve forward, shoulders pulled back, chin tucked back, sitting on the edge of your sit bones so that everything is aligned good, and then reading your computer keyboard to yourself as opposed to reaching out here. This here can go a long way towards reducing stress not only in your lower back, but mid-back, neck, shoulders. Those are where people have a lot of problems. So just correcting this can go a long way. But what you got to understand is it doesn't matter how good you sit, you still got to stand every 30 minutes, even if you only take 5 or 10 seconds and just get pulled out. But you've got to get up. A lot of people say, I sat there for 4 hours and haven't moved. I got so involved in my work. You got to move every 30 minutes. Another thing, when you're bending and lifting, people use their backs too much. They lift through their backs, they round their backs, they don't use their glute muscles. So consequently, what you have is you get a lot of people anymore that you don't know where their back ends and their butt starts. It's almost a straight line, and that's because these muscles back here, which are the biggest in the body, and it's the most mobile joint, aren't being used. You typically see rounding or lifting like this, or coming on the toes, trying to pick up children with a rounded back with the weight away from you. You've got to correct those postures. On the last video we covered hip hinging. You have to learn to move and use your glutes while you keep your back stable. Back has to be a stable structure. So the whole trunk area needs to be stable. The movement for activities needs to come through your shoulders and your hips. Two most mobile joints in the body, they're the ones that are supposed to be doing the movement. People reverse their roles, either with the shoulder or with the hips, and they use their back too much, or they use their neck and upper traps too much, and so then the shoulder or the glute muscles try to stabilize, which it should just be the opposite. The back should be stabilizing, the hips or shoulders, shoulder blades should be doing the movement. All right? Just a couple concepts about if you want to get better, you've got to correct causes. That means whether you're lifting in a gym, whether you're doing stuff at home, whether you're doing stuff with your kids. But if you correct the causes, you're well on your way then to taking care of the problem permanently. If you have further questions, contact us at physicaleverysville.com.